I've got the opportunity, Dr. Gupta is from one of my GP practice, and I got my invitation letter and got called up by the Willows practice to invite me in, so it's been great. The experience had been really smooth and had a really pleasant experience actually getting a vaccination, but I thought, what has it been like for you? I know you've been down at the centre. How has it been?
Well, no, first of all, thank you very much, and thank you very much for coming and accepting the invitation and getting your vaccination. Really pleased to hear that you had a good experience, because naturally there has been an incredible amount of hard work, in all quarters to sort of make this a reality and to mobilise it so quickly when we first found out about it. So I think there's been a lot of incredible work done in the background to get to where we were. I think as things have gone on, people have really, really taken to it very well, and things do seem to be going a lot more smoothly now. Everyone seems to understand their roles, and we're just delighted that you've had such an experience.
Great. I mean, when I was down there were queues of people that were coming and found it very, very easy to get through. How have the staff been? How have they responded to this?
Yeah, absolutely. So, I mean, obviously there is a lot to consider, particularly with regards to the guidelines, the social distancing guidelines, but the staff have been absolutely fantastic, and I think it'd only be fair at this point to kind of really thank each and every staff member at Willows Health, but also in the primary care network, Aegis, for all of their efforts, but also the kind of patients who have actually been coming, because they really, really have adhered to the guidelines exceptionally well. They've kind of, really been very patient with us and very flexible with us, and that is what has allowed it to go as smoothly as it has.
Well, I want to take the opportunity to reinforce that, and also to thank the staff who were amazing, and members of the public who have been great. But I also want to thank you and the team at Willows, and my one is Clarendon Park, and just for their leadership and support, and actually just keeping going. And I know that you've got a really hectic couple of weeks coming up as the dose 2 start to come in and we go down the age bands and all of that. So I know it's going to be really, really tough. But for Leicester, it's been so key, the work that the NHS has done in terms of meeting the response. So definitely massively in support of that. Thank you for all that you do and you continue to do. And on behalf of my colleagues in public health, we really appreciate the efforts that you guys have made.
That's very, very kind of you to say, and we do look forward to continuing this. And the one thing that I would like to say is that obviously not only do we look forward to continuing it, it's actually something that the staff are very much looking forward to, because the more that we can keep doing to hopefully get out of this situation, is something that we really, really do want to embrace. I think you've mentioned it several times as well, the way it's allowed people to pull together. A prime example being also the volunteers here, or the centre itself, even the factory across the road. They let us park there as staff, and it's just an example of how it can bring communities together, even when we're faced with such a hard situation. So thank you.
And I'm really glad that you said that, because I think that we have all used and sometimes we use things and they just like a tag or a hashtag, and very early we used the whole idea of Leicester Together, but it actually feels like it has been Leicester Together. I know that at centres there's been volunteers that have cooked for everybody, have brought food in for the volunteers that are working on their parking, people volunteering their facilities. It really has been a collective effort, and we all feel quite humbled at the fact that everybody has been so involved. So once again, thank you very much.
Thank you very much.